A good day to all. So let us start with the sessions of anatomy. To begin with the introduction to anatomy, more so knowing a bit of the history of anatomy before the introduction. So now coming to the introduction of anatomy into our subject. So as we said that anatomy is a study of body parts from macroscopic to the microscopic structure. So this anatomy is having various subtopics like the cadaveric anatomy. Cadaveric anatomy is an anatomy where the study is done on cadavers, which is what is practiced by all of us now in the medical schools, where you dissect the cadaver to know about the anatomy of every single organ, its relations, its structure and all. Living and applied anatomy go together, which you will experience once you start your clinics, where you will palpate and examine the patient to see for any signs and symptoms. So that is what is applied anatomy. So the normal what you read here in cadaveric anatomy, you are going to know and examine the patient, implicating the clinical anatomy here. Then comes the comparative anatomy. As we said, there is the study of comparison between the lower vertebrates to the human beings, that is called as comparative anatomy, we will see later. And then cross-sectional anatomy. This is what is the cross-sectional anatomy, which was way back put into the limelight by Leonardo da Vinci long back. So a part, for example, this is the upper limb. So you take one at the shoulder, one near the upper part of the arm, one in the middle of the arm. This is how the cross-sectional of that particular part shows, which is called as cross-sectional anatomy, which is having now the utmost importance in the imaging or radiological anatomy and seeing CTs, MRIs, PET scans and all that. So that is what is imaging and radiological anatomy. Then there is surface anatomy. Then there is a regional anatomy, where the anatomy is studied in one region. Then comes the systemic anatomy, where one system is being studied, that is only cardiovascular system from head to toe. Then it is the macroscopic anatomy, which is nothing but the cadaveric anatomy, where everything that you can see by the naked eye. Then comes the microscopic anatomy, where you require some instrument like microscope to see the minute structures which are not be able to see by the naked eye. Developmental anatomy, where it is the development from day one till the adult, which includes the embryology also. And then it is the pathological anatomy, which is the applied aspect of the microscopic anatomy, which is also called as histology. So let us see the radiological anatomy, which is very much in vogue now and is based basically on the anatomical structures. It is an imaging method which uses the X-rays or electromagnetic waves to capture the body parts and view them on the films. So they are the radiographs or the X-rays or skygrams also they are called as. And there is this ultrasound, CT, which was previously known as CAT scan, which is called as computed axial tomography, and MRI, which is known as magnetic resonance imaging. And this radiological anatomy has taken leaps and bounds, and now it is even used as radioactive isotope scan to scan the particular point where the cancerous cells are there, to treat to that particular point by radiotherapy. Then the PET scan. Now the PET scan, which is the positron emission tomography, which is an imaging test to check for the diseased tissues in your body, which is done by using a special dye that is containing radioactive traces. They go and settle in the diseased tissue, which will be highlighted by the PET scan. So this is what is the CT scan machine, where the patient is put on sliding table, which slides in and out of this big hole, where around this is the X-ray machine. The radioactive rays will be emitted. So this will be moving inside. So for example, if the person is moved here with head part, which is present over here, or the abdominal part, because since I have put an abdomen, let us see. If the person is pushed inside till the abdominal part, then this circular thing here rotates and takes the photographs axially around that particular part. Okay, so it is taking plenty number of cut sections in centimeters, in millimeters of this particular part only, and they are viewed by computing them onto a computer, and then they are given as films for the surgeon or a doctor to come to a conclusion what exactly is wrong with that particular patient. So when you see the CT, this is how the bones, they appear very wide. These are the ribs. Okay, so this is the thoracic vertebra here. This is the liver. These are two solid structures again. Kidneys, another solid structure, the spleen. You can see black thing here. So that is the air within the structure. So this is the colon or the large intestine. This is the duodenum here. So all these things will be viewed by the cut sections of the particular part by this rotating field here. So that's how this cross-sectional anatomy gains importance in the radiological anatomy and CT scan, MRI, PET scan and all that. And in MRI, which provides precise details of your body parts, especially soft tissues, with the help of magnetic field. It is not the radioactive rays are given by the magnetic resonance imaging that is in MRI. As we said that in MRI it is the very high magnetic rays that would be given. It is the same as CT, but inside are the magnetic radiation and magnetic waves that will be given. So the persons who are seeing here will be in an anteroom because they cannot have any metallic instrument within the room where the MRI is being done, unlike the CT scan. So here the magnetic screen which takes in the photographs are still more minute than the CT scan in its thickness. They are all millimeter wise. So it is 64 spiral, 72 spiral MRIs. That's how. So 72 cut sectional images will be taken in one part where that particular part is exposed under the magnetic field. So this MRI is very much contraindicated in persons who are having pacemakers fitted in the heart, and whoever are the patients who have their fractures mended by nailing and plating, because they're all the metals that are used for the procedures. So what happens is, such a person, when he is put under MRI, because of the very strong magnetic influence, these platings and nails and plated which were used to mend these fractures, they just come out of that. Even the pacemaker, it comes out. So that is the reason any foreign body which is there within the human being is not for MRI scan. So this is how the MRI looks. So here you won't be that much able to see the ribs here. The bony, it's more into the soft tissue excellence. So here it is, this is the musculature, what you see around. This is the abdominal wall musculature, this is the back musculature. These are the kidneys you are seeing, this is the vena cava, aorta. And when you find this more black around which is the tissue, whatever is white thing that is appearing is the tissue. So it is the hollow structure, so must be in intestine. This is the intestine again, the colon, the large intestine. So this is how the MRIs look like. And then, which is the most common thing used all over, is the X-ray or the scintigraph or the radiograph, it is known as. So here it is again radiating the X-rays which have the radiation effect. So the film is put underneath the part that is exposed for the radiation, and the X-rays beams are put from above, the other side, to know whether the fracture is there or not, or to view how the structures are. This is the chest X-ray where it shows most of the body bones in the thoracic region. This is the clavicle here, scapula, this is the arm bone, that is the humerus. These are all the spines that you see, and these are the soft structures. This is the heart here, this is the diaphragm, the lungs. They are black in color because they are having air in them, so they can't take in, they can't absorb the X-rays, whereas these bones, they absorb the X-rays, so they appear white in color. And this again, another black strip here is the trachea, which again has air in it. So that's how the X-rays are given as films, just like MRI CT, to read and come to a conclusion to go ahead with the treatment for those particular patients. Now coming to the comparative anatomy. So the comparative anatomy has taken leaps and bounds in this present century, where it is taken as a learning tool for the lap surgeons, the keyhole surgeons, wherein the pigs are taken, where they are not killed, they are anesthetized, and then the keyhole surgeries or the laparoscopic surgeries are performed in the pigs, because as we said before also, they have the near normal structures as human beings, the structure of intestine or how they are and all that. So the laparoscopic surgeries are learned on them. So nowadays even these things are being banned nowhere, not in much places, or probably nowhere that the animals are being now used for these purposes. That has come up with simulators, which are the virtual modes for learning and practicing the procedures. Here you can see a surgeon who is practicing the laparoscopic procedure which is fed into this. They observe on the screen. They can even clamp. The bleeding also happens here. They can arrest the bleeding. That's how they learn virtually doing things. So the minimal invasive surgeries and the interventional procedures also can be done without any risk to the real patients. Once they get familiarized with the simulators, then they can as well work on the real-time patients and treat them. So these simulators are most in use for the training for the laparoscopic surgeries, endovascular surgeries, and the surgeries and procedures done by obstetricians and gynecologists to improve in their skills. And even neurosurgeons can also be able to do all these things. And the last was the cadavers. Even the cadavers are used to learn these laparoscopic procedures, where the neurosurgeons and the orthopedic surgeons, all of them, they can go ahead doing these minimal invasive or the laparoscopic surgeries and learn their procedures and improve on their skills working up on the cadavers as well. So the surface anatomy deals with anatomical features that can be studied by sight and palpation without doing any dissection. That means the anatomical structures which are inside, that is in depth, can be identified on the outside of the body, taking into account few of the anatomical landmarks. So this is very essential for understanding the basic topographical anatomy, and it is very much needed for various tasks such as patient examination, interpretation of any of the diagnostic images what you see in the fields what we have seen, and then in the X-ray and MRI and all that, and performance of surgery and any other medical procedures. To examine the patient. How is the surface anatomy helpful? Here you can see a doctor is taking the pulse of a person. So how do you know that you have to take the pulse out there? So you take the anatomical landmark, which is the lower end of radius, more so the styloid process, just beneath the thumb. You can find the radial artery, which is an artery which is usually used for taking pulse. So on the skin, at this area, there is presence of this radial artery underneath into the depth, where you can take the pulse, you can read the pulse of that radial artery of that particular person. So that's how you examine. And then also auscultating, unless and until you know where that particular position of that organ is there, the part of the organ, say for example left fifth intercostal space, where the apex of the heart is there, you would like to auscultate there. So to auscultate there, you have to know which is the fifth intercostal space. Then you need to count the ribs. How do you count the ribs? To know that that is the fifth rib. So when you just drag your hand from the neck below the neck, you will find a hard structure which is called sternum or the breastbone. When you keep dragging it, just after about 2 centimeters or so, you will find a bump which is called as sternal angle. To that sternal angle, there is an attachment of the second rib. So taking that sternal angle into consideration, you start counting the ribs below. Come to a position where it is the fifth intercostal space, and then auscultate. And here also the upper border of that second rib also coincides with the upper border of the heart, which will be of great help to the cardiothoracic surgeons. And here you can see a depression just beneath the thumb, this triangular depression, which is called as anatomical snuff box. Suppose a person has fallen down from a two-wheeler or met with an accident, whatever. This wrist bone here, which are called as carpals, there is a bone by name scaphoid. If that scaphoid has been fractured, how do you treat it? You can't cut open the whole of the wrist to know where the scaphoid and how the fracture and where it has been done. So this particular anatomical snuff box relates its position to the scaphoid. Just beneath this is the scaphoid bone. So when you come to a conclusion by seeing a radiograph that there is a fracture of scaphoid bone, then the orthopedic surgeon, he takes an incision here in the anatomical snuff box and then mends it, mends the fracture, treats the fracture. So that's how the surface anatomy is very important. Then coming to the macroscopic anatomy or a gross anatomy, where you can see with the naked eye. So the gross anatomy means large anatomy. You see the large body structures like limbs, heart, lung, kidneys, all organs. So this macroscopic anatomy is further divided into regional anatomy, systemic anatomy and surface anatomy. So regional anatomy here, as I have depicted the gastrointestinal system. In regional anatomy, one particular region is being studied. So suppose gastrointestinal region is studied. Then it is this part of the region, upper abdomen. Suppose you are reading only stomach. Then the stomach is read by how the stomach is, how is its structure, where is it present, what is the histology of that structure, what is the blood supply of that structure, what is the nerve supply of that structure, and what is the clinical anatomy of that structure. So this region, the epigastric region for upper abdomen, when you study, that is called as a regional anatomy. A particular region is studied, for example upper limb. When you go to that region, you read everything in detail about upper limb, its musculature, its bones, its joints, its blood supply, its nerve supply, its lymphatic drainage, everything regarding upper limb is done. That is what is regional anatomy. So when you go to see the systemic anatomy, it is studied in system wise. That is whole of the cardiovascular system from top to bottom. That is from the blood vessels that are supplying the brain to the blood vessels that are supplying the foot. Whole of the cardiovascular system is studied at a glance. Or the gastrointestinal system from mouth to anus, that is studied there. So that is what is called as systemic anatomy, where the respiratory system is being done. So here now in the medical school, it is the regional anatomy that we follow, and surface anatomy we have seen what is appearing to the naked eye, the structures which are corresponding to the in-depth structures on the surface. They are called as anatomical landmarks, what we take them. Then coming to the microscopic anatomy, where we need an instrument to see the structures which are not naked to the eyes. So they are the microscopic structures where we need a microscope to see them, which is divided into cytology and histology. Cytology is study of body cells and histology is study of body tissues. So in anatomy here we are going to concentrate on histology, where you will be reading everything about the tissues from top to bottom again, from brain till the foot, the skin. So various tissues are studied here in the histology lab. The most amazing part of the anatomy is the developmental anatomy. It is the development of a human being from single cell to the full-fledged human. Okay, so here in developmental anatomy you see the development of a particular structure throughout the lifespan of that particular individual. This developmental anatomy is divided into the development which is seen before birth and after birth till an adult. So it is known as prenatal. Natal is birth. So prenatal is before birth, which is also called as embryology. Postnatal is the development which occurs after birth till the person attains his or her adulthood. So embryology is nothing but the prenatal development, where we all have begun our life from a single cell. How it divides to get multiplied, and few of the cells together they form tissues, and together few tissues they form an organ, and more all the organs how they form an organ systems and then come out as a human being. That is what is the developmental anatomy. During this process there might be some variations which we call them as congenital anomalies. A person may have 2 ears, a person may have 1 eye when they were born. They might not have the skull here, it might be open. They might be having the limb which is not developed at all. They might be having the fused limbs, as you see in mermaids. Okay, the limbs will be fused. So all those developmental anomalies, you call them as, will be done as teratology, which is an applied aspect of embryology. Now, the development which happens from birth to the adult is called as postnatal development, which is assessed by seeing the milestones. When a baby has started to sit, when the baby has started to crawl, when the baby has started to walk, when the baby has started to respond to the stimuli. So all these things will be recorded by the pediatrician. A pediatrician is a person who sees and treats the babies of the pediatric age group, they still adult. Okay, so this in detail you will be learning in your final year of your medicine as totally a different subject, the pediatrics. So this is what is all about developmental anatomy. As I said, in the prenatal development, it is the structural level of the body, how it forms. It is the chemistry first, what comes into as the atoms that form into molecules, and then they all, that is the DNA and all that, they form into a cell, and these cells multiply to form a tissue. Tissues together form an organ, and organs together form an organ system which come out as a human being, as a normal human being with normal anatomical structures within. Coming to know about each systems of the body, integumentary system is nothing but integument means skin. So this is how the skin, as we said, Pacinians, corpuscles. So they are found in the skin, which are the pressure receptors. How the hair follicles are, how the sweat glands are present, where the sweat glands are present, the receptors are present. Coming to the skeletal system, which is comprising of the bones which take the shape of the human body. So it comes with the blue thing, what you are seeing is the axial skeleton, which is at the center, which form the axis for the body. You can see these two yellow structures which are attached to the axial skeleton, which are called as the appendicular skeleton. Limbs are considered as appendages to the body, so it is also called as appendicular skeleton. And this skeletal system, it protects and supports the body organs like the rib cage, which is protecting the lungs and heart, the cranium, which protects our brain, and the vertebral column, it protects the spinal cord, the pelvis, it protects the pelvic organs, and the limb muscles, they give support to the other muscles and give the shape to the body. Then coming on to the muscular system, these are all the various muscles, and all these muscles are attached to the bones. So by the contraction of these muscles, the locomotion of that particular part is being produced. That is, the movement of that particular part is because of the muscles, because of the contraction of the muscles. Suppose if there is no contraction of the muscles, and that happen again with the nerve supply. Suppose that nerve to that muscle is injured, then that particular muscle doesn't function, then that particular limb doesn't move. So everything in the body is interlinked. And then comes the nervous system. So this is the central nervous system, which has the brain, the brainstem, and the spinal cord, and the nerves all over the limbs and over the abdomen and the thorax. They are called as peripheral nerves. So there is a central nervous system, there is a peripheral nervous system, which we are going to go in detail when we look into the nervous system. So now the endocrine system. So endocrine system is a system which is into secretion of hormones to regulate the body processes and metabolisms. So there is this pituitary gland here, the thyroid, thymus, adrenal glands, the pancreas, and the testis and the ovary. So all these are endocrine glands comprising the endocrine system. The cardiovascular system, as we said, it is about the circulation of blood all over the body. Lymphatic system, again an important one to know as you go ahead your medical school subjects, where it is also known as immune system, where the body is prevented by attacking the foreign substances. That means the bacteria, virus, and all that stuff. So it forms a free route for all these foreign bodies, foreign structures, that is the bacteria and viruses and other things, to go about. So these lymphatic means lymphocytes. So they are lodged in lymph nodes, where they prevent, they trap these infecting organisms to further spread. So there are these lymph nodes present at various parts of the body, where they are given name as cervical group of lymph nodes, which are in the neck, axillary group of lymph nodes, which are in the upper limb, that is in the axilla, and inguinal group of lymph nodes, which drain most of the lymph from the lower limbs. The axillary group of lymph node, they drain lymph from the pectoral region and the upper limb. The cervical group of lymph nodes, they drain the lymph from the head and neck region, and ultimately any fluid has to go back into the heart for circulation. So they get drained into the vein and then into the heart, and that's how the circulation goes on. And this lymphatic system is the main culprit also for trapping the cancer cells, where for example, there is a carcinoma of the breast. So first the surgeon would prefer palpating to know whether the axillary group of lymph nodes have enlarged or not. which shows that if they are in lung, there is a spread of this cancer to the axillary group of lymph nodes. If the cervical group of lymph nodes are also enlarged, then the spread is to the distant parts also, which is known as metastasis. So the next one to know is the respiratory system, where the carbon dioxide is purified within the lungs to give out oxygen, which is circulated in the blood for all the tissues in the body. Then coming to the digestive system, as we said, from mouth till the anus, all the food that is absorbed and the metabolisms that happen will be studied within the digestive system. Then coming to the urinary system, wherein it comprises of kidneys, the ureter, the urinary bladder and urethra, where the regulation of water, electrolytes, acid-base balance in the body is maintained. So it is the nephron, the structural and functional unit of the kidney, which does all this procedure. And all this is excreted through the ureter into the bladder, out by the urethra. Then come to the reproductive system. So in the reproductive system, it is the study of the structures that are concerned with reproduction. Okay, in females, it is the ovaries, the fallopian tube, the uterus, the cervix and the vagina. And in males, it is the testis and then the epididymis, the vas deferens, seminal vesicles. So a detailed study of all these structures concerned with reproduction come under the reproductive system. So this is what are the various organ systems that are present in the body. So this is for you. I love this quote, which says that success is a journey, not a destination. So in your professional life, your gaining the knowledge of your profession should be a journey. You cannot stop climbing your steps somewhere and say that you have reached your destination. No. So the success is a journey and not a destination very much gives us an example of what we are all going through. The COVID, which nobody has read before. It is a new virus that has come and everybody is battling to know about how the signs and symptoms they differ from region to region, how the treatment has to go on and all that stuff. So it is always a journey of knowing the subject for a physician, a surgeon, for a doctor in general. So it is nothing is a destination for the profession what you're in. You should always get updated. In say 10-20 years back, so much of CT, MRIs were not there, but now whole of the radiological anatomy has been taken leaps and bounds to come along with a lot of diagnostic procedures and the diagnostic tests that are going on to make the diagnosis much more easier and for the research purposes also. So you should always update yourself accordingly to the time of the life, what goes on. So once again I repeat that the success is a journey and not a destination. Thank you.